Hi friends, good morning, one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shivgaon. My subject is pharmacology and toxicology. Today I am going to discuss with the new point or new unit. Its name is Cardiovascular Drugs, and this unit consists of various chapters like that digitalis and related cardiac glycosides, anti-arrhythmic drugs or the treatment of arrhythmic condition, and then antihypertensive drug, vasodilator and anti-anginal drugs, and drugs used in atherosclerosis. Today I am explain with you. We will be the discuss with you the new point like the new chapter is that antihypertensive drugs. Antihypertensive drug, these points are today conduct this lecture. So one by one discuss here of these antihypertensive drug with that classification, mechanism of action, adverse drug reaction, preparations and doses, therapeutic uses and etc. All these points are covered in this lecture about antihypertensive drug. But firstly, introductory part are the show. To show this slide, hypertension is a disease characterized by abnormally high blood pressure. Hypertension is the disease characterized by abnormally high blood pressure that called as hypertension. Hypertension classified as a two types like that. One is a primary or essential or idiopathic hypertension, or this hypertension is which is the exact cause is not known. This hypertension, primary hypertension, essential or idiopathic hypertension, this hypertension is the exact cause is not known, that called as the primary or essential hypertension. And the second hypertension or secondary hypertension, which may be due to renal failure, endocrine damage or vascular injury, all of that to that produce secondary hypertension. Secondary hypertension which may be due to renal failure, renal injury, endocrine injury or harm or vascular harm or a vascular injury. So that reason having to that produce secondary hypertension. And this hypertension of the heart to decreases or to relieve by treatment by using various drugs, and that drugs called as the antihypertensive drug. World Health Organization has defined hypertension as a state in which systolic pressure is 150 mm per Hg or more. जो काय सिस्टॉलिक ब्लड प्रेशर आहे तो 150 mm पर एजीच्या वरती गेला, and diastolic pressure 95 mm per Hg or more, and that is called as the hypertension by the WHO. The drug used in the treatment of hypertension act by reducing the cardiac output or reducing the total peripheral resistance without correcting the cause, that called as antihypertensive drugs. What is the meaning of hypertension by WHO? It's defined as hypertension is a state in which systolic pressure is 150 mm per Hg or more, and diastolic pressure 95 mm per Hg or more, and that's called as hypertension. Okay, this is the introductory part of hypertension. The next slide show, irrespective of the cause, hypertension is very harmful to the body. It may lead to degenerative changes in cerebral, coronary, renal and retinal tissues. Antihypertensive drugs are helpful in the treatment of hypertension. These antihypertensive drugs are the useful to that treatment of hypertension. So next slide show the classifications of antihypertensive drugs. There are the various class are present in antihypertensive drug. Like that, 8 class are the present in this classification. One by one, discuss here this classification. So, first class is that ACE inhibitors. That's name. It's also known as angiotensin converting enzyme inhibitors. For the example of this class is that captopril, enalapril, lisinopril and ramipril. These are the example of the ACE inhibitor class for the use in the treatment of high blood pressure or hypertension. Second class is that angiotensin antagonist. Angiotensin antagonist for the example is losartan. This is also having the antagonist of this angiotensin enzyme. That's this drug or these are example of losartan. It's inhibit the angiotensin enzyme. Then third class is that calcium channel blocker. The calcium channel it's having to produce contractility cardiac, and this contractility of the heart or cardiac muscles that's having blocked by using calcium channel blocking drugs. Like that example is nifedipine, felodipine, amlodipine, verapamil and diltiazem. These are the drugs are used in the treatment of high blood pressure or hypertension. So its name is called as antihypertensive drugs. Fourth number class is that diuretics. Diuretics consist about the various drugs are present like that hydrochlorothiazide, hydrochlor hydrochlorothiazide, hydrochlorothiazide, furosemide, indapamide, spironolactone, trimethoprim and amiloride. These are the example of diuretics in the class of antihypertensive agent. So these drugs are used in the treatment of high blood pressure. Hydrochlor hydrochlorothiazide, furosemide, indapamide, spironolactone, trimethoprim and amiloride. These are the example of diuretics. Then next classification is that fifth number beta adrenergic blockers. These blocker consist about example is propranolol, metoprolol and atenolol. These are also having example of beta adrenergic blocking agent. Then alpha adrenergic blocking, because this alpha adrenergic having the contraction property. So alpha adrenergic blocking agent. So example is that prazosin, terazosin and phentolamine. Then next classification is central sympatholytics. Central sympatholytics consist of various example like that clonidine and methyl dopa. Central sympatholytics, this class consists of two example clonidine and methyl dopa, and last is a vasodilators. Vasodilators consist the example of hydralazine, minoxidil and sodium nitroprusside. These are the example of vasodilator. All about this classification of antihypertensive drug, and this classification one by one discuss here. So first is that angio ACE inhibitor, angiotensin converting enzyme inhibitors. These are also known, or these are the class of antihypertensive agent. That example or example of drug like that captopril. Captopril it acts by inhibiting the angiotensin converting enzyme. This captopril is acting on that to inhibition of the ACE enzyme, means angiotensin converting enzyme. This drug is a preventing that conversion of angiotensin first to angiotensin second. These are the enzyme are the prevent the angiotensin first to angiotensin second chemical reaction in the body. It is effective in all type of hypertension. This captopril is used in the treatment of all type of hypertension. But marked effect occurs in renovascular hypertension. But marked effect occurring in the renovascular hypertension. Diuretic potentiate the effect of captopril. So captopril or ACE inhibitor with diuretic drug are preferably to high therapeutic use. सो डायuretic पोटेन्शिएट द इफेक्ट ऑफ कॅप्टोप्राइल. डायureticचे जे काही ड्रग्स आहेत ते ड्रग्स कॅप्टोप्रिलला पोटेन्शिएट करण्याचं काम करतात, इन्क्रीज करण्याचं काम केलं जातं. तर कॅप्टोप्राइल प्लस डायureticचे ड्रग हे कॉम्बिनेशनमध्ये त्या पेशंटला दिले जातात. देन सेकंड क्लासिफिकेशन ऑफ द ड्रग लाईक दॅट adverse reaction of this captopril, these are the angiotensin converting enzyme. It's having a preventing the conversion of angiotensin first to angiotensin second enzyme. It is effective in all type of hypertension but markedly effect in a renovascular hypertension. And diuretic potentiate the effect of captopril. Adverse reaction of captopril, first is a renal damage, second is hyperkalemia. It's also adverse reaction of captopril. Hyperkalemia means it's a high level of the potassium in the blood. High level of the potassium in the blood. Then impairment of immune response. Adverse reaction, loss of taste sensation. This is also having a adverse reaction of captopril. Then neutropenia. Neutropenia means an abnormally low count of type of white blood cells or neutrophils, that's called as neutropenia, means low count of the WBC in neutrophils, that's called as a neutropenia. Then proteinuria means an excess amount of protein in the urine, so that's condition called as proteinuria, and this is the adverse reaction of captopril. Then dry persistent cough, this is also having all of the adverse reaction of captopril. Dose of captopril is that 25 milligram thrice a daily as a tablet. This is all about the captopril drug. It is also having angiotensin converting enzyme inhibitor, or these drugs are useful in the treatment of hypertension. So next drug is that enalapril. This is also having a angiotensin converting inhibitor like captopril, but it is a more potent than captopril. Also it has a slow but longer effect. It having a slow action but long effect are the produce this enalapril drug. Then it act by getting a converted into enalaprilic acid, and this enalapril is a converted into enalaprilic acid. It can produce urticaria and angioneurotic edema, and these enalapril are the produce urticaria means skin rash or triggered by the reaction to food or medicine, that's called as urticaria, are produced this enalapril by administration. And second is the angioneurotic edema. Angioneurotic edema means painless swelling under the skin triggered by allergy or drugs. These angioneurotic edema are produced by using this administration of this enalapril drug. angioneurotic edema मध्ये काय होतं तर पेनलेस स्वेलिंग अंडर द स्किन आर दी प्रोड्यूस अँड दॅट कॉल्ड ॲज angioneurotic edema. This is the angiotensin converting enzyme inhibitor class are covered. Then next class is that angiotensin antagonist. इतक्या वेळ आपण बघितलं की angiotensin कन्व्हर्टिंग एन्झाईम होतं, त्या कन्व्हर्टिंग एन्झाईमलाच आपण स्टॉप केलं होतं. आता अँजिओटेन्सिनचा अँटॅगोनिस्ट म्हणून यूज केला जातो लोसार्टन ड्रग. लोसार्टन angiotensin antagonist. It is the competitive antagonist of angiotensin second. It is a competitive antagonist of angiotensin second. It blocks all the actions of angiotensin second. It These losartan drugs block all the actions of angiotensin second. लाईक कोणकोणते ॲक्शन ब्लॉक केले जातात ह्या लोसार्टनतून, तर व्हॅसोकन्स्ट्रिक्शनची जी काय ॲक्शन आहे, अँजिओटेन्सिन सेकंडचे फंक्शन. समजा अँजिओटेन्सिन सेकंडचे ॲक्शन्स कोणत्या कोणत्या आहेत, तो व्हॅसोकन्स्ट्रिक्शन आहे. मग व्हॅसोकन्स्ट्रिक्शन ब्लॉक करण्यासाठी लोसार्टन ड्रग दिला जातो. त्यामुळं ह्या अँजिओटेन्सिनचा अँटॅगोनिस्ट म्हणून तो काम करतो. व्हॅसोकन्स्ट्रिक्शन करत असेल तर व्हॅसोडायलेशन करेल. सेकंड आहे सेंट्रल अँड पेरिफेरल सिम्पॅथॅटिक स्टिम्युलेशन. दिस इज ऑल्सो हॅव अँजिओटेन्सिन सेकंड ॲक्शन, सेंट्रल अँड पेरिफेरल सिम्पॅथॅटिक स्टिम्युलेशन. अँड थर्ड इज रिलीज ऑफ अल्डोस्टेरॉन अँड ॲड्रेनालिन. and release of adrenaline that having constriction of the blood vessel and then increasing in the blood pressure. So these angiotensin second are the block the action by using this losartan drug. Then the antihypertensive effect of losartan lasts for 24 hours. It does not alter the heart rate or cardiovascular reflexes. These losartan drug, it's not alter the heart rate or cardiovascular reflexes. It is a well absorbed orally. These losartan are administration by orally route and it undergoes first fast metabolism in the liver. Adverse reaction of these losartan drug is that hypotension, hyperkalemia, fatal toxicity and dizziness are occur, or these are the adverse reaction of losartan. Then थर्ड नंबरचा क्लास आहे कॅल्शियम चॅनल ब्लॉकर्स. कॅल्शियम चॅनल ब्लॉकर, these are the third number class of antihypertensive drug. The contractility of cardiac and vascular smooth muscle is dependent on extracellular calcium contraction. जी काय कार्डियाकची कॉन्ट्रॅक्टिलिटी आहे किंवा व्हॅस्क्युलर स्मूथ मसलची जी काही कॉन्ट्रॅक्टिलिटी आहे हे सर्व डिपेंड कॅल्शियमच्या कॉन्सन्ट्रेशननुसार असतं. जर कॅल्शियम चॅनल ब्लॉकर इंटरफिअर विथ द एंट्री ऑफ कॅल्शियम इंटू मायोकार्डियल अँड व्हॅस्क्युलर स्मूथ मसल, they having decreases the availability of intracellular calcium. So that having decreases the cardiac contractility. By these interfere with the calcium channel blocker of the interfere with the entry of calcium into the myocardial and vascular smooth muscle. So important action of calcium channel blockers. These calcium channel blocker are the having important action one by one discuss. One is the negative inotropic effect which decreases the cardiac contractility. These calcium channel blocker drugs like that nifedipine असेल, फिलोडायपिन असेल, amlodipine असेल, व्हॅरम्पिमिल असेल किंवा डिल्टिझिम असेल, ह्या सर्व ड्रग इट्स हॅविंग निगेटिव्ह ॲनोट्रॉपिक इफेक्ट शोईंग अँड डिक्रीजेस दी कार्डियाक कॉन्ट्रॅक्टिलिटी and decreases the cardiac contractility, so having decreases the blood pressure, and so antihypertensive action are the shown. Then another action is also show this calcium channel blocker is a anti-arrhythmic effect. In that anti-arrhythmic chapter, so this classification are also used. Then dilation of coronary arteries. The coronary artery having its dilation by these calcium channel blocking drugs. Then relaxation of peripheral blood vessels and anti-anginal effect also having a show by these calcium channel blocking drugs. So this is the important action of calcium channel blocking drugs. So one by one discuss of this drug like that. First is a nifedipine. Nifedipine, these are the drug, it's a dihydropyridine derivative. These are the drug, it's having dihydropyridine derivative drug. It is a calcium channel blocker used for the treatment of hypertension and angina pectoris. These nifedipine drugs are used in the treatment of hypertension and angina pectoris. The essential action is arterial dilation. ह्या निफिडिपिनचा इसेन्शियल ॲक्शन कुठे असेल तर आर्टेरिओलचा डायलेशन करण्याचं काम ह्या निफिडायपिनचं आहे. These nifedipine total peripheral resistance leading to fall in blood pressure. Decreases the total peripheral resistance जर कमी झाला तर automatically fall in blood pressure. It also has mild natriuretic action without significant diuresis are also having show nifedipine drug. Adverse reaction of nifedipine like that palpitation असेल, flushing, hypotension, headache, drowsiness and nausea are these are the adverse reaction of nifedipine. Dose of nifedipine is 5 to 20 milligram oral or 2 or 3 times a daily. Then next drug is calcium channel blocking is a amlodipine. It is also having a dihydropyridine calcium channel blocking drug. Its advantages are it is slowly but completely absorbed on oral administration. Second advantages is early vasodilator. Side effects like flushing and palpitation can be avoided. In that nifedipine showing this flushing and palpitation adverse effect, and these amlodipine are these adverse effects are avoided. Oral bioavailability is high of this amlodipine drug, so amlodipine are the commonly used for the treatment of hypertension. Dose is 5 to 10 milligram once a daily. दिवसातून फक्त 5 ते 10 मिलीग्रॅम ड्रग हा यूज केला जातो. म्हणून कॉमनली ड्रग हा amlodipine यूज फॉर द ट्रीटमेंट ऑफ हायपरटेन्शन और हाय ब्लड प्रेशर. Then next class is that diuretics. Diuretics consist about the example is chlorothiazide and its analog. These drugs are effective in the treatment of mild to moderate hypertension. These chlorothiazide or chlorothiazide analog drugs are the effective in the treatment of mild to moderate hypertension. Also, they potentiate the effect of other antihypertensive drugs. This diuretic drug it's also having increases the another effect of drug of this another antihypertensive drug. So combination of another drug with diuretics, so increasing the therapeutic index, increasing the bioavailability of drug. They act by decreasing the sodium reabsorption in the renal tubules. It's having decreases the sodium reabsorption in the renal tubules. These decreases प्लाझ्मा व्हॅल्यूम अँड कार्डियाक आउटपुट. त्यामुळे काय होईल, प्लाझ्मा व्हॅल्यूमही डिक्रीज होतं आहे आणि कार्डियाक आउटपुटसुद्धा डिक्रीज होतं आहे. दॅट्स हॅविंग हायड्रोक्लोरोथायाझाईड इज द कॉमनली यूज ड्रग फॉर द ट्रीटमेंट ऑफ हायपरटेन्शन इन डायरोटिक्स. Then example is furosemide. Furosemide it is a high ceiling diuretic. High ceiling diuretics means these are the drug inhibit the sodium and potassium in the ascending thick loop of Henle. So it's known as high ceiling diuretic. जास्त प्रमाणामध्ये युरिन बाहेर टाकली जाते, that's having called as high ceiling diuretic effect. Or these diuretic effect are shown by this drug known as furosemide. It is a strong diuretics. Diuretics means excess urination, but it has a weaker antihypertensive effect than thiazide. This furosemide it's having the weaker antihypertensive effect than thiazides. Fall in blood pressure is due to reduction in plasma volume and cardiac output. This furosemide having fall in blood pressure due to reduction in the plasma volume of the blood and cardiac output are the reduced, that having decreasing the blood pressure, and it has a short duration of action of only 4 to 6 hours in the body. It's this furosemide drug in the short duration of action it's only 4 to 6 hours only. The next class is that beta adrenergic blockers. The fifth number class is that beta adrenergic blockers, and the drugs which belonging to this group are propranolol, metoprolol and atenolol. These are the drugs are consisting beta adrenergic blockers. Mechanism is that the adrenergic blockers produce an antihypertensive effect by the following mechanism. नेमकी हे जे काय ड्रग यूज केले जातात यांचं मेकॅनिझम कसं असेल ते आपण बघूया. डिक्रीजेस इन कार्डियक आउटपुट बाय ॲन ॲक्शन ऑन दी हार्ट. म्हणजेच कार्डियक आउटपुट जो आहे तो डिक्रीजेस करायचा आहे बाय ॲक्शन ऑन दी हार्ट. डिक्रीजेस द रेनिन रिलीज फ्रॉम द किडनीपासून जे काय रेनिन नावाचं केमिकल निघते, जे काय रिलीज होते त्यालाही डिक्रीज करायचं आहे. त्यामुळे ही ट्रीटमेंट होईल हायपरटेन्शनवरती. सो ट्रीटमेंट फॉर द हायपरटेन्शन. Then central action by reducing the sympathetic outflow. This is the mechanism of these beta adrenergic blockers. The beta adrenergic blockers can be used alone or with other antihypertensive drug. These beta adrenergic drugs are the administration singly or combination with another drug, so it's having a best result or best high therapeutic effect are the produce. Then next class is that alpha adrenergic blocker. The 6th number class is that alpha adrenergic blocker, and these class drugs which belonging to these groups are prazosin, terazosin and phentolamine. Prazosin, it is a selective competitive antagonist of alpha 1 receptor, and alpha 1 receptor blocking drug leading to that peripheral vasodilation, decreases in peripheral vascular resistance and decreases in blood pressure. This drug does not produce reflex tachycardia, and also it does not produce postural hypotension. There is no alteration of renal function. There is no alteration of renal function, and prazosin is useful in mild to moderate hypertension. The various adverse reaction of alpha adrenergic blocking drug like that giddiness, drowsiness, tiredness, weakness, nausea, diarrhea, fluid retention and nervousness, these are the adverse reaction produced by prazosin or alpha adrenergic blocking drugs. These prazosin drugs are the used in mild to moderate hypertension. Then next class is central sympatholytics. Example of drug is clonidine. On intravenous administration of clonidine produces short hypertensive effect. This is followed by prolonged hypotension and bradycardia are produced. It acts mainly by central or and minor peripheral mechanism. Clonidine stimulates alpha adrenergic receptor in the vasomotor center, and these block the release of noradrenaline from nerve terminals, and this leading to lowering of blood pressure and bradycardia. These central sympatholytic or clonidine are the hypotensive effect of clonidine is less when given alone. त्याचा hypotensive effect जो आहे clonidine is less when given alone, so it is combined with diuretic. The hypotensive effect clonidine is less when given alone, so it is combined with diuretic drug by this clonidine drug. Clonidine is having intravenous administration, it's having a short hypertensive effect. This is followed by prolonged hypotension and bradycardia. This is the central sympatholytics clonidine drug. Then adverse reaction of this clonidine drug: dry mouth, constipation, drowsiness, mental depression and impotence are the adverse reaction of this clonidine or central sympatholytic drug. Dose is that to start with 0.1 milligram once or twice a daily, or maximum 0.3 milligram thrice a daily orally. This is the very low dose of this clonidine drug. Therapeutic uses: it is used in antihypertensive agent and prophylactic in migraine and for glaucoma. This is the therapeutic uses of clonidine or central sympatholytic drugs. Then last class is that vasodilators. Vasodilator consists about the hydralazine drug. Hydralazine is a hydrazine derivative. It is an inhibitor of monoamino oxidase inhibitor, but there is no correlation between this effect and hypotensive action. Mechanism of action of hydralazine: it has an agonistic effect on beta adrenergic receptor. This hydralazine drug, it's not effect on the no correlation between this effect on and hypotensive action. But this hydrolyzing of the mechanism of action of hydrolyzing is that it is a agonistic effect on a beta adrenergic receptor. Is that combination of the beta adrenergic receptor with hydrolyzing is having agonistic effect on the hypotensive or to treatment of hypertension. Because of this, it produces vasodilation accompanied by tachycardia and increases the cardiac output. It also acts by depressing the vasomotor center. This is the hydrolyzing. Then adverse reaction of hydrolyzing is headache, nausea, weakness, palpitation, flushing, and tachycardia. Also, neuropathy, which is reversed by pyridoxine. This is also having adverse effect of hydrolyzing. It also produces priapism, or it's also known as painful erection. This is the adverse effect of hydrolyzing. Then diazoxide. Diazoxide, it's also having the vasodilators or व्हेसल डायलेशनचं काम करण्याचं काम ह्या ड्रग्स केलं जातं. Diazoxide is a chemically related to chlorothiazide, but it is not a diuretic. In fact, it produces retention of sodium and water. It has powerful hypotensive effect, which is due to डायरेक्ट आर्टेरिओलर डायलेशन. ज्या काय आर्टरीज आहेत त्यांचं डायरेक्ट डायलेशन करण्याचं काम ह्या ड्रगचं आहे डायझॉक्साईड. आणि जर आर्टरीचं डायलेशन झालं तर ॲटोमॅटिकली जो काय ब्लड प्रेशर इन्क्रीज झाला असेल तो कमी करण्याचं काम ह्या डायझॉक्साईडच्या ड्रगचं आहे. इट प्रोड्युसेस अन इमिजिएट इफेक्ट विच लास्ट फॉर 12 hours. हा ड्रग दिल्यानंतर लगेच ताबडतोब इमिजिएट ॲक्शन दाखवली जातो आणि त्यानंतर तो 12 hours काम करतो. It also has a potent hyperglycemic effect. This also drug shown the hyperglycemic effect. And then last drug is sodium nitroprusside, is also having a vasodilator drug. This drug decreases the peripheral resistance by acting on both arterial and venous smooth muscle. It produces a rapid but short action. So for continuous effect, it is administration by intravenous drip. Sodium nitroprusside are the uses in the emergency treatment of hypertension, control hypotension during surgery, and acute myocardial infarction. These sodium nitroprusside are the used in the emergency case of the treatment of hypertension. So this is all about the antihypertensive agent to treatment of the hypertension or high blood pressure. So thank you so much. So next point cover in next lecture. Thank you.